And good morning. Welcome back. I'm Mabel, Jong. You're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. I'm so pleased to have in the studio right now Dan Morissette, who is Senior Executive VP and CFO of Dignity Health. Good morning, Dan.
Oh, good morning. Good morning. I'm well. Thank you, Mabel, and thank you for having me.
Well, great to have you. And you have a lot going on over at Dignity Health. You're completing a mega merger with Catholic Health Initiatives. You have a focus on population health and also some innovations that we'd like to explore with you. Tell me first about the priority that your company has made with population health and what sort of opportunities are you seeing there?
Oh, sure. Great. Thank you, Mabel. Thank you for that. And by the way, let me just take a moment and thank the World Healthcare Congress for having me here today. I'm excited about a panel discussion I'm going to get to partake in a little bit here as well. So population health. I mean, really, let me kind of start with the big picture, then go to a little bit about what we're actually doing in population health. I mean, we realize that everything we're there for now is really for the consumers and the patients who we treat at Dignity Health, right? And so population health in that regard is completely consistent with our goal of keeping people to have longer and healthier lives. Yeah, I only mention that in context because otherwise we talk about programs as if they are done somehow in isolation. I mean, the reason that Dignity Health has invested so much in terms of money, time, resources in population health is because it's the right thing to do for our consumers, right? Okay. So I just want to mention that. And so when we think about population health, the reason Dignity Health has been able to do this really, or at least do it effectively, is we were an early adopter of the electronic medical record system around that you're familiar with, of course, around the country. And so this provided us with a real platform to have the opportunity to gather data about the work that we do within Dignity Health and then apply that to the patients and the consumers who come to see us again tomorrow. Right. So but in addition to having kind of the big data, which is the term for the day these days in healthcare, what we really try to do is combine that with solutions that actually work for people. So I just want to give you kind of an example of that. So Dignity Health has, in our Sacramento market, just as one example that I thought of on my way over here today to meet with you. In our Sacramento market, we treat a number of people who have COPD. You know, COPD, of course, is has been a national epidemic for many, many years. And so our data scientists, our physicians, our nurses got together and said, well, how can we better serve this population? What can we do different that would make things work for the people who we're trying to take care of here? And they implemented a new approach. And as a result of that new approach, some of the early results are that the readmission rates are down substantially for this particular population. And so that then would imply that the there's a benefit being understood by the consumer, as well as the costs, of course, of care would go down because of lower readmissions.
Okay.
Yeah.
And in this, are you finding more about precision medicine? You have a program that is being focused on right now. Can you talk a little bit about that?
Oh, sure, absolutely. So about 18 months ago, first of all, Dignity Health has invested ourselves in precision medicine, which really is about customizing treatments for patients and doing the genomic work that's required that allows treatments to be tailored for an individual based on their own genomic profiles. So we have been working on that on our own. And then about 18 months ago, we were very excited to announce a formal initiative with Catholic Health Initiatives, whereby we have a precision medicine alliance with them, and where the two organizations are working together. And it works very well for us because both of us are mission-based organizations and both committed really to improving the health of the people we take care of. And so that alignment has worked so well for us. We've actually started with a couple of service lines that we've rolled out in the Dignity Health facilities in Arizona, and we've also rolled it out in the CHI facilities in Nebraska. And we've mentioned this happens to be in the area of oncology, but there are other service lines that we're going to be working on, and they will be implemented by the end of the year. Okay. So it's affected our pharmacy, it's affected our research enterprise, it's affected our service lines, and it's really been wonderful for us. And we think about the vision of actually being able to raise the effectiveness and the efficiency of care for individuals and prolonging their lives through great care.
And you also have a partnership with Apple, I understand, to get some of the medical record information on iPhones, which is different and unique?
Yes. In fact, Apple, this was all announced maybe 4 or 5 months ago, okay, that Apple actually was engaging in this, and we were very excited about it. As I already mentioned, we were one of the early adopters of a formal electronic medical record system, and I'll spare you the full Dignity commercial, but I will tell you that, we have invested in technology that enables patients really to enable themselves. And so when Apple came out with this opportunity to use the iPhone for an electronic medical record, it was completely consistent with what we do at Dignity Health, which is provide consumers the opportunity to empower them really to have access to their own medical information.
And are you finding that patients are really welcoming the opportunity to be able to take this on themselves versus trying to go through a system to find out information that they want at their fingertips?
Absolutely. I mean, there are service scores that, and of course, healthcare, that's a whole, we could have a very long conversation about service scores in healthcare, but it's been documented over and over again that those who have access to their own information, who use more of the electronic tools, also rate their own experience, their health status experience much, much higher. So we're almost 100% certain that will happen also with the Apple application. Of course, it is new, so the data, the specific data on it has yet to be published, but we're absolutely confident that with systems like Dignity Health and other innovative healthcare providers and a great company like Apple, that it's going to be a home run for the consumer.
Great. And Dan, may I ask you, what keeps you coming back to the World Healthcare Congress?
It's the diversity of the group of people who come here, right? So we have providers here, we have payers here, we have entrepreneurs here, we have really almost everybody comes to the World Healthcare Congress. You have the CMS administrator here, and I mentioned to you before, I would like to submit a couple of questions there, being a large provider of healthcare. So I think it's just a great group of people. I think the networking opportunities are there, and I think the learning and the speakers are excellent.
All right, Dan Morissette, thank you so much for your time today.
Great, thank you.
And I'm Mabel Jong. Thank you for watching. Stay tuned. We have many more interviews to come.